Hello, welcome everyone, and thanks so much for joining today's info session. We'll start the presentation in a few moments, but I just wanted to review a few housekeeping items before we get started. If you haven't done so already, I encourage you to pop yourself on mute and to turn off your video. This is a great session to multitask, so feel free to go for a walk or load your laundry as we'll go through each slide in detail. As we're going through the presentation, when you have any questions, you can just pop them in the chat box. We usually have a few minutes at the end of the session to do a quick Q&A. If you have a question that you don't feel comfortable sharing in the chat box, or if it's a super specific question, I would just encourage you to send us an email and we'll get the right team to answer that question for you. Lastly, you may have noticed that we refer to Jack Health and Jill Health. As part of our company, we have two health brands. Jack Health deals with men's health issues, whereas Jill Health focuses on women's health issues. However, our weight loss program is identical for both. So that means that the program, the medications, the experts you talk to, the content you receive is the exact same, whether you're on Jack Health or Jill Health. We just have the different brands for marketing purposes. Alrighty, let's jump in. So some of the things that are on our agenda for today are what you should expect in this program, how this program is different from other programs out there, what is included, how much it will cost you, the medications we prescribe, and then addressing some questions at the end. All right, so before we jump into the content, I'll take a moment to introduce myself. I'm Bianca Wallace. I am the virtual care coordinator here at Jack and Jill Health. I'm basically the liaison between you, the patient, and the wellness team. So I'm sure I'll be in contact with a lot of you at some point. I'm here to support you along your journey. I'm here to assist you with any program questions or concerns that you may have. I collaborate with the wellness team to keep you updated on your progress, assist you with troubleshooting access to your care, and directing you on your next steps in the program. The best way to get in contact with myself is via email at bianca.jessica@jackhealth.ca. All right, so why was this program created? Well, we realized that many of us have tried to lose weight in the past and have not been successful. We've realized that weight loss and weight management is really about our biology, our body's chemistry, and frankly, a large portion has to do with our genetics. And so we created a scientifically based program rooted in clinical proof. We combine the incredible appetite management that comes from the prescription medication with building the healthy habits that are going to fit into your life. Now, because most of us will not be on these medications for our entire life, when we start to dose down, we want to make sure that you aren't running the risk of gaining back all the weight you just worked so hard to lose. So this program is really and truly unique for those reasons. It's the only one in Canada that is science-backed, medically supervised, and comprised of teams that are registered and licensed healthcare professionals. So how is this program different? So if you take a look at the diagram, it shows some of the ways that we are different from the other programs out there that you may be familiar with, but also this program is unlike those fad diets. It's not about a short-term fix because we know and we recognize that those are not permanent. We take a more sustainable approach. We understand the yo-yo diets, and this program is not that. Rather, we focus on healthy habit building and how we are combining that with the medications. This program is not the kind of program that you can get from your typical family doctor. So what is included and how much it will cost you? So there are 2 to 3 charges each month, depending on the medication you get prescribed. The weight loss support subscription will be charged for monthly support. This is not an optional fee and will be applied every month that you are in the program. This covers off access to your registered dietitians, registered kinesiologists, social worker, nurse practitioner, expert content consults. It'll also cover off delivery straight to your door of your medications, as well as blood work diagnostics and analysis. As for the medications, we only prescribe Health Canada authorized options and we ship directly to your door. So it's really awesome. You don't need to actually visit a pharmacy. And the medication starts at $300 per month for a monthly supply, and they go up to a maximum of $605 per month. Some patients, however, will be able to cover a portion of the medications through their private insurance plans. But we'll definitely help you check ahead of time to make sure you're aware of what your costs are expected to be. And we'll cover that off a bit more in our next slide. So your wellness team really is key to your weight loss journey. Once you have started your medication, you will begin your monthly wellness calls around week 6 on the medication, once you have adjusted to your full dose. You will first begin with your dietitian calls. They will help minimize deficiencies and muscle loss. They help you reduce the risk of weight gain post-treatment through their expert coaching and advice. During months 1 to 3, once you have started your medication, the wellness team will focus on skill and lifestyle planning by discussing topics such as balanced meals, goal setting, exercise, and meal planning. And then during months 4 and onward, they will focus on maintenance. They will assist you with your goals, troubleshooting difficulties, and then, of course, accountability. So these are some examples of blog posts and email content that you will receive. The first one is an example of an email that you'll get in about week 2 of the program that walks you through our recommendations on how to track what you're consuming. The second is an example blog post that we reference. It goes into details about specific topics. In this particular example, it's talking about body recomposition or recomp that you may have heard about. And the final example is one of our check-in emails that we send usually once a month to nudge you to take measurements to upload into our system so we can help you keep track of your progress. So it really is a good idea to stay engaged so that you can be prepared and informed. If you are already enrolled in the program, please let us know if you're not getting these emails and we can help you get access to them. They cover a range of different topics that will be useful to you. So what medications are prescribed? So you may have realized that the theme of today's presentation is personalization and customization, and this still holds true for the medications that we prescribe. So the actual medication we prescribe is really going to depend on a few important factors. The first one is going to be your medical history. So what issues have you faced in the past or perhaps are tackling now that we need to know about? The second is going to be your health goals. So why are you trying to lose this weight in the first place? Is it to keep up with your grandkids or to run half a marathon in 2 years or to fit into that dress that you love? Of course, all of these are valid reasons, but it's helpful for us to understand so we can craft and adjust the program to better fit your mindset. Third is going to be what other medications you may be on. So we do need to ensure that there won't be any negative interactions with the medications that we prescribe. So an example is that some anti-anxiety medications cannot be taken with the medications we prescribe for weight loss. The fourth is going to be your personal preferences. So do you have a strong opinion on taking oral tablets versus self-injections? This is good for us to know ahead of time. And last but certainly not least is your blood work results. So these are going to confirm if this program is actually a good fit for you. If we see any wonky levels or issues, we may reject you to get those addressed first before joining the program. Now, I want to pause here really quick to emphasize an important point. So just because you start this process, it does not actually guarantee that you will get a prescription. This is a medical program, and thus we have to be very careful with who joins. We do have 3 milestones that participants need to go through before we potentially prescribe you a medication. The first milestone is the eligibility quiz, which will quickly determine if this program is a good fit for you. It asks you 4 simple questions. An example of one of the questions is if you are pregnant, breastfeeding, or chest feeding. If you answer yes to any of these questions, we will automatically reject you as the medications are not safe for babies. The second milestone is where we will review your online consultation answers, your medical history, and any other medications that you may be on. The team is checking if there are any issues that immediately popped out. If there are any issues at this point, we will reject you and refund your weight loss support fee at this point. So for example, you're taking medications that aren't appropriate to be taken with the weight loss ones that we might prescribe. And then the third milestone is the blood work. So this is going to confirm if this program actually is a good fit for you. At this point, we'll review your results and walk you through any issues or deficiencies. So for example, we did have a patient in the past with full-blown diabetes that was not aware. We had to reject them so that they can get this issue tackled first before coming into our program. Now, before we wrap things up, I did want to share that we do have a contact us page that we encourage you to take advantage of. You can get the information on medications, your shipments. You can learn more about our team that you'll be working closely with. You can get access to your profile. You can chat with our medical and pharmacy team and access to our support team all in one central location. So I would encourage all of you to take a look at our contact us page. So that does bring us to the end of today's info session. If you have any questions, all questions can be sent to hello@jackhealth.ca or hello@jill.health as seen on the screen. If you have any questions specifically for myself, you can send me an email at bianca.jessica@jackhealth.ca. Thank you.